present the Having Our Say report to you today. It is Alameda County's consumer perspective on the African American utilization report. May you have the slide? There it is. All right. My name is Jaleah Winn, as Gigi said, and my connection to Having Our Say is that I assisted with facilitating planning meetings for the report and worked collaboratively with PLCC staff and PLCC members to complete the report.
My name is Kenneth Davis. I am a PLCC member. Currently, I am the chairperson for the PLCC African American Empowerment Committee. Also, I am a part of the team working to implement the Having Our Say.
So the purpose of our presentation is to highlight the report and its strategies, which have the purpose of improving outcomes for African Americans in the public mental health system. We also want to celebrate the strategies that have been successfully implemented, and we want to recognize African Americans for our legacy, our leadership, and resilience. Please say Ashe if you agree that Black Lives Matter. Ashe. Can I get an Ashe if you are committed to supporting African Americans of the public mental health system to practice wellness and recovery? Ashe. All right. By round of applause, how many of you are familiar with Having Our Say? Okay. Well, here we go. We're going to share a little bit more about it, and we thank you for your round of applause. So as I said, this report is in response to the African American Utilization Study. There were 3 strategies created that were developed by PLCC members and staff members. We brainstormed collaboratively and created the following 3 strategies: mental health and spirituality trainings at all levels, formal peer provider training, and informal peer support groups. The first strategy to successfully be implemented was mental health and spirituality trainings at all levels. We would like to continue expanding this training to reach more spiritual communities, consumers, providers, and stakeholders. Each strategy presented in the report, and copies will be available today, they're out in the foyer, have a preamble, an introduction, and evidence-based research that supports the strategy, as well as an action plan. So for each of the strategies, we developed a plan, a timeline, and a list of partners for collaboration. And another aspect of the process is that we engaged in community building so that we can honor the African American heritage, strengths, and the culture. All of this was a part of the process of Having Our Say.
Mental health and spirituality training for all levels. This is one of the report's 3 strategies. This strategy has been accomplished. The purpose of this strategy is to create more welcoming faith-based communities, especially for African Americans that are impacted by mental health and substance abuse issues, including consumer and family members. To assist mental health providers in understanding the importance of spirituality to wellness and recovery. There was a collaboration with the Innovations Grantee, Mental Health Friendly Congregation of Tri-City Community Development Group, funded under Round 2. PLCC members participated and reflected on the stories on a series of trainings that covered mental health and spirituality. For example, we explored the faith and spirituality of the African American community, appropriated support for individuals living with mental health conditions, and gave tribute to the African American activists, leaders, and social justice organizations. We did all this in small and large group dialogues and through lessons led by providers and clergy. As a result, the collaboration with the entire mental health community, the pool of consumer champions, and the AAEC was able to fulfill the mental health and spirituality training strategy. Informal peer support. According to Having Our Say report, peer support is a way of role modeling of consumer based on lived experience. It can transpire in many ways, in group settings, in community settings, and in the workplace. It is empowering and ensures recovery. Peer support can use a self-help model which is founded by personal choice to begin and continue recovery. Peer support is an essential component of the public mental health system of care. This comes from the Surgeon General report in 1999. Furthermore, informal peer support groups are an opportunity for collective collaboration and mutual understanding of wellness and recovery in the environment with individuals that have shared lived experience. Formal peer provider training. A peer provider for African American community is an African American with lived experience receiving service in the public mental health system. One of the African American Utilization Study Group's recommendations is to strengthen the cultural relevancy of service, and this value resonated with the POCC. POCC members decided upon formal peer provider training as a strategy, and here are some of the details that were established to assist with setting this up. The plan specifically highlights facilitators' involvement and training for a curriculum focused on African American culture designed for peer providers along with regular employment training classes. POCC members expressed the importance of becoming providers in the public mental health system because it has been proven that consumer providers can broaden access to peer support, engage more individuals in traditional mental health services, and serve as a resource in the recovery of people who have lived experience in the mental health system. There are so many groups and individuals that have contributed to our having our say. We thank all of you for supporting and putting together the report and its implementations. Please stand when called. The POCC members. Pastor Horacio Jones, Family Bible Fellowship Church and CEO of Tri-City Community Development Center.
We'd like to acknowledge Paulette Franklin of the POCC African American Affiliate. She's the staff person who is currently providing leadership with the implementation of the report. POCC AAEC officers and members, if you don't mind standing again or raising your hand. Thank you. In her absence, Sally Zinman for facilitating the design and writing process of the report. Gigi, yes, please. Gigi Crowder, may you please stand? We acknowledge you for supporting the vision of Pool of Consumer Champions, AAEC, and being committed to cultural competence, to equity, and collaborative service that empowers and supports African Americans, consumers, family members, and providers of the public mental health system. We acknowledge Alameda County Behavioral Health Care Services, including former Director Dr. Marye L. Thomas, MD, for courageous efforts to address the issues facing African Americans in the public mental health system. Although she is absent, we recognize Dr. Thomas, and last but not leastly, we say thank you and acknowledge Alameda County Behavioral Health Care Services support staff persons such as Patricia Lopez and Agnes Catalos and Helen Braden.
Fallen but not forgotten, POCC members and activists, including but not limited to Darnell Livingston, advocated for African American male providers in the public mental health system. Michael Bell advocated for consumer rights and fair treatment. DeWitt Buckingham advocated for social justice and empowerment. Everyone here today is in agreement that Black lives matter. We honor you today to celebrate the collective work to make having our say successful.
Ashe, and so it is. And as we close, we will share an excerpt of a speech delivered by Malcolm X to youth from Mississippi in the 1960s, and it is still relevant to our lives today. One of the first things I think young people nowadays should learn is to see for yourself and listen for yourself. Then you can come to an intelligent decision for yourself. If you form the habit of going by what others say about someone or going by what others think about someone, instead of searching that thing out for yourself and seeing for yourself, you will be walking west when you think you're going east, and you will be walking east when you think you're going west. This generation, especially for our people, has a burden more so than any other time in history. The most important thing that we can learn to do today is think for ourselves.
And so, when others say you will never be well, think for yourself. And when others say you will never make it, think for yourself. When others say Black lives don't matter, think for yourself. When others say transformation is not necessary, think for yourself. When others say recovery is not possible, think for yourself. Think for yourself. Think for yourself. Think for yourself. Thank you.
And so he and another individual and I have done statewide work. He's going to share with you the most important part of our work, which is why it is so important for African Americans to embrace their faith practices through our project, Keepers of the Flock.
I sense a t-shirt coming, some mugs coming, some refrigerator magnets. Think for yourself. Anybody feel that too? Anybody feel that? Somebody needs to make that happen. I love that phrase. Obama said, "Yes, we can." And this is think for your. I love that. I love it. But we want to talk about Keepers of the Flock. It's a training that we've developed over the last few years. That's been significantly influenced by at that time, the African American Issues Committee, and now the African American Empowerment Committee, right? Still committee, Empowerment Committee. And when we were developing mental health friendly congregations, I encourage you to go out to the lobby and grab one of the brochures. What was so important was hearing the consumer and family voice. And so we vetted absolutely everything through, and those of you who were part of that process, from day one, even day minus 15, when we were just in the conceptual stage, we took it to the consumers, we took it to the Empowerment Committee at that time. And the integral part, one of the things that really came out, not just through that process, but through research across this nation, and in general, and in our state, is the role that the faith community plays in the African American community. And so, a few years ago, Gigi and I, we participated in the Cultural Competency Summit down in Santa Clara, and we titled it Keepers of the Flock. And it's really where faith and spirituality and mental health care intersect. Keepers of the Flock, because we're all a part of the flock, responsible for caring for one another. So, and it's based upon, next slide, it's based upon, if you've gone to a church, been a couple of days, if you went on Easter, Mother's Day, or Christmas, growing up, you've heard the story of the parable of the lost sheep. Right? How many of you heard the parable of the lost sheep? And that's the passage of scripture that is based upon in a book called, written by an individual named St. Luke, the 15th chapter and the 3rd verse. And can y'all just read that aloud? Just read that aloud. And I want you to pay attention to the words, and then I'm going to ask you what stands out to you. What stands out to you? So go ahead and read verse 3.
Then Jesus told them this parable.
And then continue on. Keep reading.
Suppose one of you has 100 sheep and loses one of them. Does he not leave the 99 in the whole country
or you can just blurt it out. Lost sheep. Oh, wait, raise your hand. Okay. That sounds like a good idea. Okay. No one left behind. Anyone else? Rejoicing.
The 99% was left.
The 99% was left to go after the one.
After the one.
Okay.
The shepherd went out after the sheep. The leader went out after the sheep.
The leader went out after the sheep.
I found my lost sheep.
I found my lost sheep.
The one that was lost was just as important as the 99 that's dead.
Powerful. Yes. Someone actually went out. Wow. She said he wanted everyone to rejoice with him because he found his one lost sheep. Everything you just said is here. Principles to guide us, whether you're a consumer, a family member, faith leader, provider, county, we're all charged. We're all the flock. It's not just the church. It's not just the community. It's not just consumers. It's not just family members. It's all of us working together. We are all responsible. What I love about the parable, it tells us, first of all, that we have to pay attention to one another. Isn't that amazing? How would he have known that one sheep was lost if he didn't pay attention? Right? Because it's 100 sheep. He started out with 100 sheep. And I don't know about you, but I live in mountain houses, so we have a lot of undeveloped land, and so every now and then they put cows out, but mostly they put sheep out. And it's just a bunch of them. And they're just out in the open area. Normally they're clustered together, but I don't know how many of them there are. But somehow he knew. And at that particular time, they were what you would call a Bedouin society or wilderness society. And so they would keep their sheep in sheep pens or sheep folds. And there was one gate in and out. And so the shepherd's responsibility was to keep count of the sheep. And so he would keep count when he would open up the gate during the morning, when it's time for them to go out and graze, go out and get exercise. He had to count each one. So they couldn't go out. The gate wasn't wide enough for two to go out. It was one at a time. So he would, almost like a counter, he would, like a clicker, he would just count each one. So it tells us that after the day had been spent, now he's gathering them to bring them back into the fold. So they've come out, he's gathered all of them, they're back at the sheepfold, right at the gate, and he gets to 99, and one is missing. Right? He pays attention. It's so important, depending upon what our lens is, whether you're a family member, a faith leader, organizationally, whatever the situation is, each of us have a different perspective and a different lens and a different view on consumers and family members. But it's important for all of us to pay attention. Matter of fact, look at your neighbor, look at the person next to you, and give them a church lady voice and say, pay attention.
Pay attention.
Yeah, pay attention. Can you put it back up on the screen? And it's important for us to pay attention. I got about a couple more minutes. Because each one of them count. Each one counts. Someone said it over here. Each one, this is so important. Each one of them, go back to the previous slide. Each one of them count. Each 90, this is very important. 99 were not more valuable than one.
That's right.
This is very important. Because sometimes we can get caught up in budgets. We can get caught up in programs. We can get caught up in policies. There's a story of Jesus once when he was with his disciples, and they were eating on a day in which they weren't supposed to be laboring, on the Sabbath day. And the religious people looked at him. Greg? Is that Greg? Okay. You look like a friend of mine. I'm sorry, I'll keep going. The religious people scolded and reprimanded Jesus because his disciples were eating on the Sabbath. Jesus said something very important. He said, the Sabbath, he said, man was not made for the Sabbath day. He said the Sabbath day was made for the benefit of man. And it's in organizations, in our churches or whatever, everything exists for the benefit of the individual. And that's what he demonstrated. Every last one. You had 100 ones. And so he wasn't just satisfied, at least I got 99. At least I've got not. No, he said what? He took the 99 back out of the fold, put them in a safe place so they could stay together. And that represents programs we have, peer-to-peer that we have, growth opportunities and support groups within our churches. And so that's where we cluster. but every now and then someone's missing. And we have to pay attention, not get excited and settled and satisfied with the numbers that are there. Someone has to pay attention and realize Lindsay isn't here. Kenny isn't here. One of these lenses has to see that. Are y'all working with me? And then the third one says, because we have to be aware of how people wander off. And we see it in the parable of the shepherd. We see it particularly in another gospel account in the gospel according to St. Matthew. And that's where it tells us that the sheep wandered off. In Luke, it just says he was lost. It focuses on the end result. Matthew focuses on the process. And the word wandered off means that, you know, they would go out and drop their head and they would just be eating. And somehow he got preoccupied with eating, or she got preoccupied with eating, and the rest of the herd went on. The rest of the flock went on, and his head stayed dropped. And then the shepherd knew that once his head or her head lifted up and no one was around, that sheep is vulnerable to attack. Yeah. And the principle you can hear, I love it, and we see it in the reaction of the shepherd is, the shepherd did not blame the sheep for wandering off. The shepherd took the responsibility to take it upon himself to go find the sheep. It's so important. And my family had to minister and counsel with a sister and brother-in-law whose son was diagnosed with schizophrenia at about 19, 20, 21 years old. And one of the first things they started doing was blaming themselves. What did I do wrong? What didn't I see? It's not about blaming ourselves. And then it's not about, they were in a period where they blamed their son. Thought he was just rebellious. No, no one is to blame, but all of us have. Someone said it earlier, we have the responsibility to care, right? And he went out, and we see it. He lifted the sheep on his shoulders, right? Didn't scold them, didn't blame them, carried them, took them. And if you're a family member, you know the burden. If you're living with a mental health challenge, you know the burden. And living out there without your support system is like a sheep out there, and wolves and predators are out there, and we see it in substance abuse, we see it in behavior. We speak. Why? Because they're out there isolated on their own. They're not to blame. The flock has the responsibility. And my last slide, please, Ed, and click it once. And it's our responsibility for us to do everything that we're doing because Black minds matter too. Thank you very much for your time.
So we do this work in the African American community, but we also do it for the Latino community. We do it for any individual who's lost. And so I have to acknowledge I was a little lost when I was doing this work in a period of time. I was working in a system where I felt like as soon as we identified the problem, we needed to move forward right away with the solution. We didn't move as quickly as I liked, but I had a mentor who at that time I didn't prescribe to be my mentor. I wasn't ready to be told how to do things. So I went forth at 55 miles per hour, and right in this room, she got validated and she told me, slow down, we'll get there. But we don't have to get there as quickly as you think, because the work that we're doing is very difficult work. And there's going to be speed bumps. And I landed on a couple of them. Oh yeah, I did. Remember when I was out for 4 months? Yeah. You do? Okay. I was out for 4 months. And it was at the end of this month. And in this month in February, African Americans feel empowered. So I started thinking about, well, Rosa Parks made a decision not to sit in the back of the bus. I can certainly not sign that write-up they want to have me write up. So I got back to work on Monday morning and I said, I'm working in a hostile work environment in which the needs of my community are not embraced. I did not know when you do that for the county, they have to investigate. I was away from my work for 4 months. It was paid, so I'm thinking about another way. No, just kidding. I was kidding. No, I love my work. I had not worked in a very long period of time. Since I was 17, Jack in the Box, 51st and Teller, I was working. So why, be away from my work wasn't the solution. But Dr. Thomas had told me, she is the only African-American, she was the first African-American mental health director across the state. Now we have 2 additional women who are our directors, Cassandra Thomas in San Bernardino, and then there's a new individual who's in Merced. I can't think of her name off the top of my head. But Dr. Thomas took courage to do this report. And she tried to tell me that it required courage. I did not understand it at that time. I've talked to some of my co-workers and I said, no, but you know, when we wanted to get funded for this, then she didn't do. She knew exactly what she was doing. And so today I'm launching a scholarship in her name. Aww. It's called the Dr. Mary Thomas Scholarship. I sent her an email before the holidays and I said, would you mind if we did this? And then it took about a month. And then I said, another one, and I said, I know we had difficult times when you were working here. Because we did. I said, I didn't understand, because I'm from a different generation. Remember, I grew up around the corner from the Black Panther Party. Free Huey, black as we want to be. We're going to get those pigs off our block. And she grew up with real consequences. And had she had a mindset like mine, she probably wouldn't have made it to be a doctor. The opportunities for her would have been, because we don't deal with lack of achievement. We deal with lack of opportunities to achieve in our community. So she said, and came on a Sunday, right before I went to church, I got an email from her where I had asked her if she was okay with me doing it, and she said she would be delighted. And thank you for even considering it. Now, I thought that absent meant she was still kind of perturbed with me. But we've communicated since. She let me know that her technology had gone down, so she wasn't able to access her email and all that. But I think we must always honor those who made sacrifices for us to be where we are. So this first year, I get to be selfish, because at this point, I know it's going to start at $1,000, and at this point, I'm using my own money to do it. And it's going to be for a African American who wants to come into this field. I'm not saying that the individual has to have a 3.5 or a 4.0, because we have to understand in our community it's more important for someone who had a hurdle and overcame the hurdle and got back on track. So we're going to start with looking at essays from students at Oakland Technical High School, because that's where I went. Yes, I'm a bulldog. That may have a 2.8 or higher, but we'll look at their past records and we'll see if they had a slip, and then they'll write an essay about how they overcame.